Hi everyone, it's Dr. Gabby from Dr. Gabby Clinics, and I'm here today to talk to mums and families about COVID-19, also known as the coronavirus, which is now a world pandemic and it's affecting, thousands of people today. And I want to be here to give you helpful advice, not to make people panic, but I feel that the more facts and information you have, the more prepared you can be to protect yourselves and your family as we see how this virus unfolds in the UK in the days to come. The advice I will be giving is up to date as of today, which is the 13th of March, but the advice will be evolving on a daily basis, so it's important to make sure that you are up to date, and I will do my best to kind of keep people informed during this period. This is the biggest public health issue to affect people of our generation. It's going to change people's lives forever, and I just encourage people to be kind and support everyone through this difficult period. So, one of the first questions that I received about coronavirus is, what are the symptoms? And I've got some notes here because I have done a lot of research, so I can give you the most up-to-date information. It's my job to do that. So, common symptoms of coronavirus are fever and cough. So when the body is reacting to a virus, the temperature of the body goes up. So anyone who has a fever above 37.8, equal to or above 37.8 degrees, is advised to self-isolate. Not everyone has a thermometer, so if you're feeling feverish, you're feeling warm in yourself, you should be self-isolating, and this is for 7 days. You should also be checking the 111 online advice, and if you feel unwell, definitely you must be doing this, and if you're unable to check the 111 advice online, you should be calling them. Please be aware that the lines will be busy. You may have to wait a long time to speak to someone, but it's important that you take these steps so that the kind of healthcare that you need can be offered, and you will go down sort of the right pathway in terms of treatment. Cough, especially a dry cough, is another symptom. If you are experiencing this, you should be self-isolating at home for 7 days and looking at the 111 online advice. This is general advice for the whole population that everyone in the UK should be following. Now, sometimes symptoms, these are symptoms that people may get with coronavirus but will not always get with it. These are things like fatigue, aches and pains, sore throat, headaches, and also shortness of breath. So these are things to look out for. Rarer symptoms could be runny or stuffy nose, and then a symptom that is not really seen with coronavirus is sneezing. So just to summarize, fever, cough, fatigue, aches and pains, sore throat, headaches and shortness of breath, these are all symptoms of the coronavirus. I hope this information was helpful, and if you have any more sort of general questions about the symptoms related to coronavirus, please do get in touch with me. I'll be more than happy to help. This is my job, this is what I've trained for, and I'm here to keep the public informed. Okay, so I had a really good question, which was in relation to mums and babies, and if it's okay to breastfeed baby if you have the virus, or if you should be formula feeding or expressing and feeding. And this actually is linked to the whole concept of contact with your baby if you are positive for COVID-19. And I've been looking at the real-time information, real evidence, real science that's been coming out of China when it comes to mums and their babies and COVID-19. Now, there were a few cases in China where they had a look at mums who tested positive in the 3rd trimester. And they had a look to see, did baby test positive for COVID-19 after delivery from mum? And the good news is that they found that there were no positive cases where baby tested positive. So this goes against vertical transmission of the virus. This is transmission from mum to baby during delivery or pregnancy. I guess a really important question is the virus present in the breast milk? And I think they looked at 6 cases in China, and they tested the breast milk, and it's reassuring that there was no virus in the breast milk. But you have to take this evidence with a pinch of salt because it's such a small number of cases that was looked at. Whether the breast milk provides antibodies against COVID-19, I don't know. I haven't been able to find any evidence that confirms or denies this. I guess the main risk for infants in the close contact with mother is the fact that they may be likely to share infective droplets. And in China, the advice that they gave women is that if you're positive when you deliver, you should be separate and kept isolated from your baby for 14 days. Now, this is quite a big deal. For mum and baby to not be together, this is really going to affect bonding in some of the critical time periods of neonatal life. So actually, the Royal College of Obstetrics and Gynecology have not given this as general advice. The latest advice that I've looked at, I mean, this may change, but they have said that they do not feel that that is the best way forwards in this country. Obviously, it's a personal decision, and each individual mother would need to be counselled to decide on the risk and the benefits and make their own individual decision on what's best for them and also their family. I'm going to read out some specific advice that the Royal College of Obstetrics and Gynecology have given to pregnant women, sorry, not pregnant, but women who've had babies who want to stay close with their baby and also breastfeed during this period if they are positive for COVID-19. So I'm just going to read this out word for word so that you have the exact information that you may need if you potentially are in this position. They say that for women wishing to breastfeed, precautions should be taken to limit viral spread to the baby. This would include hand washing before touching the baby, breast pump or bottles. It includes wearing a face mask for feeding at the breast. The following recommendations for pump cleaning after each use would be to consider asking someone who is well to feed the expressed milk to the baby. For women, bottle feeding with formula or expressed milk, strict adherence to sterilisation guidelines is recommended, and where mothers are expressing in a hospital, a dedicated breast pump must be used. So I hope that this information is helpful for women who are pregnant and are worried about maybe contracting coronavirus and what may happen to them and baby when they deliver. If you have any more questions about this, please do shoot them at me. I just want to be really clear and summarise to say that the latest guidelines from the Royal College of Obstetrics and Gynecology in the UK is that the potential benefits of breastfeeding baby outweigh the risks of potentially transmitting the virus to baby during the breastfeeding period. That is the current advice, but that may change, and it is an individual decision. Every mother should be counselled by their doctors if they are COVID-19 positive as to the individual risk and benefit of breastfeeding so that they can make an informed decision on what's best for them and also their baby. Okay guys, so the next question I had is, what is the best way I can protect my family and myself from getting the virus? And I have 3 tips for you. The first and most important tip is for people to wash their hands. And I don't really think that this is something that should be a new thing for people. People should have been washing their hands regularly since day one. Wash your hands as soon as you get home from being outside. Wash your hands before you go to the bathroom, but after you go to the bathroom, before you eat, after you eat. It's really important for people to be regularly washing their hands. Wash your hands after you cough, after you sneeze. We need to keep our hands clean. And by washing them with soap and water, this is the best way that we can do this. The next thing that you can do to kind of protect your family is avoid going to really crowded areas. So at this time, it's not a good idea to go to a football match where there may be thousands of other people that you may come in contact with, because the more people... So the final question that I had was, how long do we think it will be before this virus gets killed off? And this is a very difficult question. There is no precise or exact answer, but we can look back and see what's happened in other countries and make a prediction. So for example, the death rate in China reduced dramatically over a 6-week period. So this is from the 1st of January to about the 20th of February. This is from the peak death rate. So it's about 6 weeks for things to kind of tail off. We may be about 2 to 4 weeks away from we could possibly be about 2 to 4 weeks away from a similar situation in terms of what's happening in Italy at the moment. But this cannot be guaranteed, because the way this virus spreads will be different in different countries and societies depending on health interventions, behaviour of people, healthcare that is available, okay, population sizes, social and environmental factors. We don't know how it's going to spread country to country. And for example, the way that this virus has spread in Italy is completely different to what's happened to, in countries that are much closer to China, such as Thailand, Hong Kong and Singapore. And Hong Kong and Singapore are two countries that have done really well in terms of containing this virus and preventing large number of deaths. And it may be because they took extremely early action and because they have experience in managing such infections because of the SARS outbreak that happened a few years ago. But at the end of the day, the same intervention in a different country may not have the same effect. Again, there are cultural and behavioural, environmental, social and also economic differences between all of these countries. I really hope and believe that the British government are doing the best that they can for our country. They have had a look at all the different models of how things might progress, and I think what they're trying to do is delay a big outbreak in a way that will ensure that the NHS has the capacity to give people the intensive care that they need, the people who may really experience a tough time with this infection. I've really enjoyed sharing this information with you guys today. I have to admit I've been slightly obsessed in kind of keeping on top of the information, but this is because I'm so passionate about what I do, and this, you know, for times like this is actually why I went into medicine, so that I can be there to kind of help inform people, give them the most up-to-date information, because I have had a look at all the information, and also I'm ready and there to help my patients and be there for my patients through this difficult time. This is what I've trained for, and this is why I became a doctor in the first place, to help people in their time of need. Alright guys, take care. Bye.